Alright, interesting and random pharmacy things, part 3. The analgesic activity, aka pain relief, of methadone is actually shorter than its pharmacological half-life. Its half-life varies from about 8 to 59 hours, and then its duration of action for pain is about 8 hours. Because of this, it's dosed daily when used for opioid use disorder, and then it's dosed every 8 to 12 hours when used for chronic pain. I usually see it dosed about 3 times a day when used for this indication. Another interesting pharmacy thing is the drug varenicline, formerly known as Chantix, actually has a new brand on the market. It's called Tervea, and it's actually used for dry eye disease. I think this is cool. It's a nicotinic acetylcholine receptor agonist, so it activates the parasympathetic nervous system. Another random pharmacy thing is some gabapentin solutions have something in it called xylitol. This is a sugar substitute or sugar alcohol. This is toxic for dogs. Gabapentin is sometimes used in dogs for seizures, anxiety, and nerve pain. This brand is an example of one that has xylitol in it. I go to Daily Med to look at the excipient list. This is a brand that does not have xylitol in it, Amneal. So if your dog's prescribed gabapentin solution, check with your pharmacist to make sure it's the one that doesn't have xylitol. Another interesting pharmacy concept is pharmacokinetic enhancers or PK boosters. These allow other drugs to remain in the body longer at higher concentrations. These drugs usually inhibit the metabolism of another drug to increase the half-life. One example of a PK booster is the CYP3A4 inhibitor ritonavir. It was originally developed as an HIV protease inhibitor, but now it's just formulated with other drugs as a PK booster. One example of a combo with ritonavir is Kaletra. It's used for HIV. A more common example where we see ritonavir is in the COVID drug Paxlovid. We have the normal dose at the top, and then the renal dose adjusted at the bottom for EGFR less than 60. Ritonavir slows the metabolism of nirmatrelvir, again, by inhibiting CYP3A4, and allows for higher systemic exposure. Another pharmacokinetic enhancer is cobicistat. Cobicistat is in the 2 HIV drugs Simtuza and Genvoya. It's used to enhance systemic exposure of 3A4 substrates like darunavir and elvitegravir, where bioavailability is limited and half-life is shortened by 3A4 dependent metabolism. I'll also mention the drug bupropion, although it increases dopamine and norepinephrine on its own, is in the drug Auvelity in order to increase plasma levels of dextromethorphan via 2D6 inhibition. Auvelity is a newer drug on the market for major depressive disorder. The bupropion allows for twice-a-day dosing of Auvelity. Remember Delsum, the cough suppressant over the counter? The immediate release is usually dosed every 6 to 8 hours or 3 to 4 times a day. Speaking of CYP2D6, this is the enzyme that metabolizes hydrocodone to the more potent metabolite hydromorphone, oxycodone to oxymorphone, and codeine to morphine. Codeine isn't recommended in children less than 12 years old because the CYP2D6 enzyme is genetically polymorphic, meaning this enzyme can be overfunctioning or underfunctioning in people. Ultra-rapid metabolizers can be at risk for overdose with codeine because, again, metabolized into morphine. Last random little pharmacy thing is oxycodone is more potent than hydrocodone. Here we see about 5 milligrams of oxycodone is about as potent as 7.5 milligrams of hydrocodone. This is my CDC opioid app, by the way. I use it to calculate morphine mill equivalents.